So I think what you're hearing is, in some sense, different people's approach to this, and that may be one of the issues. We may need to have overall a more systematic approach. There is some literature out there that provides some reasonably good roadmaps and checklists for this, and this is a list of 4 manuscripts that actually get at a more systematic, mechanical, here's a checklist of how to do this. Now, in our institution, I've taken these and created a bit of a checklist for our fellows when they come in so that I can sit down with them and say, here's how peer review ought to be done, here's a checklist, here's some suggestions for learning how to do this as they begin to do some peer review with us. But while I have this list up in case you're trying to write them down, let me just preach for a little bit. So why do this? Why are you here sitting in this room? I think there's 2 very critical reasons. One is we all want to make surgery better. We all want surgery to advance. We wouldn't be members of these societies, we wouldn't be taking time away from our practices at this meeting if we didn't want to make surgery better. This task of peer reviewing the literature and improving the literature is critical to that. We cannot move surgery forward without a means of properly disseminating the information to the scientific surgical community of what's being done. And this peer review task is absolutely critical. If we don't have this, it's like having a flat tire or a cog in the wheel. So this is a critical function, and we all need to do it. The second reason that I think it's really important for you to do it is for our societies, EAES and SAGES, this is the second most important way that we get out there what the society is doing. The first most important way is the meetings that we have. The second, and some would argue maybe the journal should be first, is the other way that it gets out there what the society is doing. The third reason to participate in peer review is that you get the opportunity to see before everybody else some of the best work that's being done. Now, with that privilege comes the responsibility of not disclosing that material, but you get to see it ahead of everybody else. So, just some thoughts on how to do it well. First of all, do the review. If it really messes up the system if you either say you're going to do it and don't do it, or you don't respond at all. So that's obviously critical. Look at the review as an opportunity to learn, have a system, and those papers that I put up there first all have reasonable systems that you could adopt to the task of surgical manuscripts. So what actually is the task? And this is taken from that first article. The task is to responsibly evaluate. It's to verify and improve the manuscripts. You are making suggestions to make the manuscript better. It's to educate both the authors and the editors about that topic. It's to weigh your expert opinion against the submitted work. And it's to provide your review in a respectful, unbiased, and timely manner. So this capsulizes what the task is. To me, the easiest way to construct your thinking about a review is the question or the hypothesis. That's really the heart and soul of what you're doing. If there isn't a clear question being asked and answered in that manuscript, there's probably a problem. So you need to dig and find. Hopefully you don't need to dig. Hopefully the author of the paper has made it clear what the question is. But if they haven't, you need to figure out what it is, and in your review, you need to help the authors articulate what that question or hypothesis is and whether it's being potentially answered. You've got to figure out, is that question important? For surgical endoscopy, toenail clipping is not an important topic. So, you are part of the process of saying whether the particular topic being reported on is important or not. Is it satisfactorily addressed or answered in the manuscript? Sometimes the question is great, but it hasn't been adequately answered. Other times, there's a lot of data that answers some or multiple questions, but that hypothesis has never been articulated clearly. Finally, this is a very important point to me. Will the reader be educated on the field related to the question? When I read an article, and when I tell my fellows, my residents, my medical students to read an article, I expect that when they finish reading that article, they will have been educated about that field. So textbooks uniformly are at least 5 years out of date. This literature should be far less out of date. And I tell my residents that if they want to pass their boards, the best way to do it is to read 3 articles a day throughout their entire residency. If they do that, they will be ready for the boards in terms of their basic knowledge. But it's because in each of the manuscripts, they should be educated about that piece of the field. So in surgical articles, the accoutrements are also very important. The photos, the illustrations, the references, the diagrams, the operative descriptions, the equipment lists. These are uniquely important, I think, in the surgical literature. So in summary, I would say don't look at this task as drudgery. Figure out a way to enjoy the task, because there is much to enjoy in it. There's learning, there's early knowledge of what's going on, there's the thrill in my mind of participating in something that's really important to our patients and to the field of surgery. Recognize the value of this to your career, to your personal education, to surgery, and again, ultimately to our patients. Thank you very much for your attention.